Hello, and thanks for attending our lightning talk. My name is Dwight Berry, and I'm a principal data scientist at Seattle Children's Hospital, a 400-bed pediatric hospital in Seattle, Washington, USA. Our talk will discuss how ethical choices are implicitly embedded in regression analyses, using a recent example from our surgery department. In short, how your categorical variables are coded for analysis can influence the inferences you can make from your results. Our hospital system sees more than 500,000 patient visits each year, of which more than 79,000 require translation between English and the patient and family's preferred language for care. More than 130 languages are spoken by our patient population. Of these, the most common is Spanish. As a result, we've started our first all-Spanish-speaking operating room this year. Interpretations generally are carried out both in person with in-house interpreters and through video exchanges with interpretation companies. At our hospital, we're always trying to ensure that we care for everyone equally and that outcomes are as equitable as possible. For example, our surgery department was interested in determining whether there are differences in outcomes after surgery, such as 30-day mortality and serious adverse events. A straightforward logistic regression could look at the patient's language group as the exposure, adjusted by variables that describe surgery complexity. To learn about our exposure variable, the patient's language group, we should first understand that coding schemes are an integral and usually implicit part of a regression model. The UCLA stats pages have a great reference on regression coding schemes in R. In our experience, we find that while statisticians are usually aware that coding schemes exist and that they are a required part of a regression model, clinicians, data analysts, and computer science-oriented data scientists are not. Contrasts usually refer to the differences between regression coefficients of interest, but likely for historical reasons, contrast is the name of the R function that shows you how categorical variables are coded in the model. So contrasts and coding schemes are synonyms. And if you're a computer scientist, you might know this practice as one-hot encoding. In this talk, we are only going to explore 3 coding schemes: treatment contrast, sum contrast, and weighted effect coding. Using each coding scheme, the results of the logistic regression model are shown here. The coefficients are exponentiated to display odds ratios. Some results you see here are clearly because of small n, but I would like you to draw your attention specifically to outcomes for the Spanish-speaking patients. 2 of the 3 results for Spanish speakers are statistically significant, while 1 is not. These 2 significant models suggest that the Spanish group has almost twice the odds of a bad outcome, whereas the sum contrast model is more equivocal. So at this point, you might be asking yourself, which coding scheme is correct? To explore this question, we'll look at each coding scheme in turn using a simple example. R's default coding scheme for regression is called a treatment contrast. In the MT-CARS dataset, if you wanted to see the simple relationship between miles per gallon and the car engine cylinders, 4, 6, or 8, the LM function will automatically set up the coding scheme this way, where each level of a factor will be compared against a reference level, which in this case would be the 4-cylinder engine. This is called a treatment contrast, because traditionally the reference level would be the control level in a controlled experiment, and the other levels would be the treatments. You can see or set the coding scheme matrix with the contrast function in R. We will return to the surgery example shortly, but for simplicity, let's look at the coefficients from our MT-CARS model. We can see that the 4-cylinder engines get about 27 miles per gallon, while the 6-cylinder engines get about 7 miles per gallon less than that, and the 8-cylinder engines get about 11.5 miles per gallon less than these 4-cylinder engines. Some contrasts don't use a category level for a reference level, but instead use the grand mean of all the levels as the reference point. This is accomplished by having each column in the coding matrix sum to 0. Thus, the coefficients from the model become deviations from the grand mean. So we can see that the coefficients are different using sum contrasts, which makes sense because we're looking at difference from the grand mean of the 3-cylinder types. The intercept is the grand mean. Since the coding matrix is set up to sum to 0, the level's coefficients must also sum to 0. So the missing 8-cylinder coefficient is simply the value that allows the other coefficients to sum to 0. In this case, that is about negative 5.4. Now stop for a minute and consider, if a consumer of these results didn't know about coding schemes, what would they take away from the differences in coefficient values? Weighted effect coding, which is a special case of sum contrast, weights each category level by its sample size instead of a grand mean. This approach is not built into base R, so the WEC package on CRAN provides a simple way to set it up. You have to specify which category level will be omitted in the contra WEC function. It won't be omitted from the model, but it will be from the coefficients presented in the results. Now, the intercept is the sample mean, and the coefficients are deviations from that sample mean. The missing category, 4-cylinder engines, is again the value where the other coefficients will sum to 0, so about 5.3. The practical differences of these coding schemes can be seen in this example from the WEC package article in the R journal. It shows the relationship between race and ethnicity group and income in US dollars, where the size of the circles represent the sample size for each group. The sample mean is shown as a solid horizontal line, and the grand mean of the 4 groups is shown as the dashed horizontal line. The 3 vertical double-ended arrows show the effect size between groups based on the coding scheme. So which coding scheme is correct? We can look to the descriptive statistics to see which model comes the closest. When we do that, we can see the predicted values are all identical, regardless of coding scheme used. So when we consider all these different odds ratios, and their different inferences on whether our care is equitable, we should always remember that they all lead to the same predictions, regardless of what the regression table shows. So it is important to note that the marginal effects for each coding scheme are exactly the same, since underneath it all we are still talking about the same model, the same data, and the same variables. Our choice of reference point affects the conclusions that can be drawn about inequities, as well as the value judgments on what is, as well as what should be, standard or normal. When you have a categorical exposure with no natural order or control, the choice of contrast is an ethical choice, not a statistical one. R's default treatment contrasts often make white, English-speaking males the reference group. This typically supports the dominant social narrative, which is known to be inequitable. This places importance on the privileged cohort and fails to change the rhetoric of what is considered to be the norm. By using some contrast, either regular or weighted, we are explicitly decentering away from a single referent. However, comparing to a grand mean and presenting results only as odds ratios can dilute the overall effect, minimizing inequities. Thus, marginal effects should always be presented alongside regression coefficients or odds ratios. Thank you for listening.
Well, thank you very much. That was a very interesting talk that really highlighted the difference between statistical questions and questions of a non-statistical nature. Yeah. Are there, do you have a specific example or two that is might be one of your favorites in terms of showing how useful this difference in perspective is beyond what you've already told us?
Yeah, I've just dropped a link in the chat for something that I think is it's a fairly old paper, but something I think is a really good overview of why we have to think about these things beyond just the statistical details.
Yeah. Oh, old papers are sometimes the best. I mean, if somebody got something right and it happened a long time ago, I don't feel any need to, find a better way when something very good is already right at hand. So does anyone else have a quick question? Okay, Shanushka says, I'd be really curious to know what this analysis would make of non-surgical health outcomes. Yeah, yeah. Any reactions?
Would make of non-surgical health outcomes, such as chronic health conditions. I think it doesn't particularly matter whether it's surgery or non-surgical. It's just, I think, any condition in which you're trying to understand equity and you have a categorical variable that has no natural order, I think the sum contrast are the things that you should be using. because then you're not privileging any particular group.
Good. Yeah, well, that sounds very sensible. So I think we should wind this talk down and go to the next room. Thanks very much, and we'll see everybody in a minute on the next stop. Thank you.
Thank you.
Okay.